Welcome to IDFC First Bank presents Leaders of Tomorrow Season 11. I'm Sunanda Jay Seelan. On the show tonight, I'm in conversation with Padma Bhushan Suchitra Ella. She's the MD of Bharat Biotech. This is part 2 of the special conversation with this very special leader talking to us about what the initial days were like for the company. She talks to us about vaccines and just increasing awareness about the importance of vaccines. She's also talking to us about patents and participation of women in the workforce. Listen. I was reading a story of your early days when I understand one of your field salesmen picked up the phone on Dr. Krishna Ella and said the doctor that he was meeting with kept insisting that he would only look at multinational brands and pharma brands. Have things changed a lot in terms of acceptance now? Not just domestically, but internationally also. For the longest time, WHO, for instance, didn't sign off on Indian vaccines. Have things, particularly with regards to COVID, have things changed? And if quality is being incorporated, then do you feel that some of these issues will be fixed?
Yeah, because when we started out in it was in the late 90s. So our first product was hepatitis B. A vaccine for that, and then at that point of time the only other competition out there was another Indian manufacturer who had also just started a year ahead of us, and then there was this huge multinational company which was marketing its vaccine all over the world. So maybe when the first time around the doctors or the medical fraternity came across vaccines being made in India, which were normally for them coming from, were imported into the country. And this was the first time the second generation vaccines were being made and being marketed. So that was a challenging time frame for us to go and, prove and also show them technical data. Yeah. Because they're not going to be just satisfied by, sitting and talking with the doctor for 15 minutes or 20 minutes by saying that my vaccine is the best. But we need to have all the technical data, the clinical data, all the other product development data, information. And then, of course, later on at a point of time, if the product is then also certified by other agencies like the WHO or some other countries like the European MEA or there are many other countries who have their own audit standards. So if we can go on to prove that all these levels of quality have been proven by this product, then it starts making, it breaks the ice for them to understand that, oh, okay, here we have products in India now that are equivalent to the counterpart that's out there in the West. Sure. So, but it was a huge, it was tough. It was like scaling Mount Everest.
Do you think some of these challenges and questions could be addressed if the patent and how easily you can applying, I understand, is easy. Getting that patent is the challenge. Do you think some part will be addressed by that?
See, the getting a patent or taking it to the next levels again is again comes back to how you absorb technology into the process, how innovation is brought into the process, and how you invent, innovate, or develop new processes. So for us in our molecules and biotechnology, it's a process related novelty that we have to demonstrate. So there may be 4 or 5 other companies in the world that have the same product exactly, but the process is different. So we establish what you call a novel method or a platform which is different from the other four that are out there. And then that information is then again submitted in the form of the intellectual property rights that we put into the dossiers and the information that is given to the patent offices. Then they will then look at ensuring that there is no violation of our information as compared to what has been filed by the other companies that are out there who would have already done this process themselves, maybe ahead of of any one of us. So I think it is the second and the third and the fourth one who comes into this game will have to establish that level of technical sensitivity and that level of technical expertise that does not encroach on the other existing patents that are out there. So that's very important. And that we demonstrated from the very beginning, right from the days of our hepatitis B onwards. We have ensured that as a young, small startup organization back in the late 90s, we ensured that our primary vision was to develop new technologies, new platforms, new processes, and new products. So wherever we go, because we don't want to be again bogged down with violating of patents and intellectual property rights, and then getting, pulled into various other legal and other issues in terms of the product. It can be very serious because it'll just bring down the whole, the organization can come down. And we were starting out, we are small, we're not very large in that sense compared to the large multinationals that are out there. So we need to be very cautious as we develop these new technologies, that we ensure that we want to develop this kind of information, not only just for the company, but also for the country on a larger scale, because these technologies will be filed from India. And so it goes to show that India will be a developer of technologies, and India is presented as a innovator, as an inventor, and as a developer, and those kinds of attributes start coming, not only just for the organization but also to the country as a whole.
Sure.
And that's important going forward, because ours is all about research, science. Every day, things change. Nobody expected SARS to blow up on us, so it's not taken for granted. So as and when these kinds of infectious diseases start taking a larger turn and in affecting human lives and population. We had 10 years ago, we had H1N1. So that was also, it was not on the same scale as what we have now with the pandemic. But the H1N1 also was a serious situation for many countries to have picked up and said, oh, we need to have vaccines ready if by chance it starts, becoming a pandemic. But maybe it didn't. We had, issues. We could contain it in terms of being at an endemic level. And then maybe also gradually the virus itself also dwindled away, and rather than spreading itself. But we were ready as a country with vaccines. So this was 10 years back. So we need to constantly be upgrading our knowledge, our research capabilities, our academic, scientific partnerships, and collaborating with institutions within India and outside of India. So all this is an ongoing process, and I don't think it will stop, because if it stops, then we stop. The clock will stop for us as well as an organization.
I'll take a quick break on that note. Much more on the other side. Do stay tuned. We're back in just a moment. Welcome back with us here on IDFC Films Bank presents Leaders of Tomorrow, Season 11. Female leaders and entrepreneurs who are in similar fields such as yours tell me that they still question, even to this day, about being in non-traditional industries. What is your response to that? One. And two, while you have enough female students perhaps signing up for STEM courses, as they get older and progress in their career path, more and more start dropping out. Is there a simple answer to that?
Simple answer.
A simple solution to that?
Simple solution. I don't want to call it hereafter non-traditional areas at all, because I think that was maybe when we were as a world, after the wars and the Industrial Revolution. Maybe at some point of time we had what we call the brick and mortar industry. But once I think the computer and the IT technologies, and then thereon the biotech processes, and also research, so much so for that aspect, the amount of research that is done in countries elsewhere and also to some extent in India is not about whether it is neutral to the gender. We find enough scientists and doctors and physicians and experts, rather, academicians who love science. They're passionate about science, and they love to teach, they love to practice medicine, but they also teach. And then they also are not happy with that, and then they want to do research. So they tie up with either public grants or private grants, or they work with private organizations like ours. And there are many of them out there in the world. And also now in India, we see a lot of that, that's coming up also. I think the first generation of women scientists in India have now come to the echelons, of being where they are today, the last 25, 30 years. And we see a lot of eminent women in the sciences today. There's been DBT secretaries, the Department of Biotechnology. There's been secretaries, means they're not IAS officers, especially in this particular department. They're all very, very acclaimed scientists, researchers, and teachers who have taught and practiced science throughout their careers. And they've come to that level of being in the government and policy making and so on and so forth. When it comes to industry, it's less actually. Yes, maybe because the youngsters today think that this is not meant for me. And the life sciences, but there is again, I don't know the percentages, but wherever you go, there are now doctors, women doctors. Erstwhile it used to be just the gynecologists and, the obstetricians who were there. But of late you go and see there's surgeons. There are women who are practicing surgery, who have become oncologists, who've taken up many other, forms of areas of medicine, which probably was a kind of like maybe considered as a male bastion before. So I think in industry, the issue comes down to whether you have 7, 8, 10, 12 years to give for a particular science that you are passionate about. Or if you don't have the time, then you have the 4-year programs or the 5-year programs that people generally opt and want seek employment after that, and then they move on to their careers, building their careers. But science is a little bit long drawn in that sense, because for someone who wants to grow in science, I think a minimum of a post-graduation would be very, very helpful. And then along the way, they also pick up a lot of other things that they have to, because it's just not pure sciences. When you have to apply science, then it becomes the entire gamut of running an organization changes. Because then it's regulated, it's, everything else, all the other aspects of the operations set in. So women have to give themselves time and energy and focus in order to get to that kind of a point.
Sure.
But I'm sure they can make it. And I know people do ask me too in the last, especially not now, but earlier on, I was also faced with the same question as to why I was in this kind of a space. But maybe I was lucky because I had Dr. Krishna along with me. So both of us kind of, walked into it and took 50-50 or whatever.
Sure.
So it was a little maybe easier on me. But if you are alone as an entrepreneur, I think, but I don't think this should deter women and the youngsters, the next gen, to look at science as an option, because there's so many areas that have now opened up. And the pandemic has shown us how we need to work together. It's not about being big or small or medium anymore. The pandemic has also shown ways as to how we could work from our own, wherever we are, from whichever part of the world we are, and we can still contribute towards, developing something or taking something forward.
Sure.
So I think there's lots of areas that science now requires in both young men and women.
Sure.
Legal is a big aspect. If you just touched upon intellectual property rights and patents, we need to have any number of legal experts and youngsters especially who understand the science bit of it, and then who can also extrapolate it into the legal context when it comes to, taking it on to patenting and intellectual property rights filing and so on and so forth. So there's many avenues now which have opened up, that the primary degree of science is very helpful, but then they can add on with many other areas of commercial, legal or finance or marketing.
Yeah.
Management is another area which is very much required.
Sure.
The sky is the limit.
Since you were talking about Dr. Ella, I must ask you your advice for our entrepreneurs who are watching this interview. 90% of India's small businesses are family owned and run. Your daughter is involved in the business. Your son, till recently, was with the business. He's taken a break to go back to his studies.
Yeah.
How do we ensure that this is successful? Is there a formula you can give us? Is there a mantra?
There was no cookie cutter formula at all available for us, because we just started from scratch. Yeah. And even we are first generation entrepreneurs. So when we relocated back to India from the US, we just started on a clean slate. And there was nothing in the textbooks for us to go back and refer and understand as to how we could go about doing things. We just did it by the trial and error method. We would fall down, get up again, fall down, get up again, and those cycles went on. When the children grow up, I think what happens is, in our case, both of them opted to do their graduation in medical sciences. So that was their own choice.
They opted to.
They opted to.
Sure.
There was no engineering, I think, in our family. Probably my father was an engineer, but then it stopped right there. But both the children went into medical sciences. So when they completed their graduation and post-graduation, the understanding of the life sciences then becomes slightly better for them, because they come from that same background. Either you are a practitioner of medicine, or you, on the other side, you can also be a researcher or an innovator or an inventor and a developer of molecules or vaccines. So both the children started looking at trying to get their hands into working in junior management and areas of the company. They wanted to try it out. And because, again, there was no force from us.
Sure.
There was no there was no theory for us to deploy to them. And we don't want to also do that, because we felt that this is a very long journey. of how one would have to be very personally convinced of taking. And this can't be enforced upon someone else.
First and foremost, Bharat Biotech was the winner of the Leaders of Tomorrow's Company of the Year Award in 2016. Perhaps you can tell us what it meant to get that award, one. And two, one piece of advice for an entrepreneur who's watching today's interview.
Every time an award comes our way, it's only another, I don't take it as a feather in our cap, but we always felt that it is a great acknowledgement to the ethos that we have built in the organization and the entire ecosystem of the company. Because we believed from day one that innovation was going to be the primary and the end goal for us in terms of how this organization would go forward. And every time in 16 as well, when we got the ET award, it just goes to, it reinforced that strong conviction that we had built in ourselves over the years. And it also then now says, you can't deviate anymore and you stick to it and you bet, it's a huge responsibility as well by giving us that kind of encouragement or motivation, not just to us, just the two of us or somebody in the top management when we receive the award. But I think when we display the awards in the organization, in the offices back or in the plant and the facilities, we want all of the employees to see it, and it's not in the chairman's office.
Sure.
It is always displayed for everybody to see and for them to feel that these are the strengths that we have and these are the areas of contribution that we could probably still continue to do as an organization. I think it's very important to have a very strong foundation. Whatever be your realm of speciality or specialization, it does not matter. But ensure that your foundations are very strong, because our educational system is still very theoretical and we are not ready for entrepreneurship. So in order to achieve that, it probably may take us, for everyone, again, it's not a one size fits all kind of a formula that we can have. But at the same time, and we can't be those one-off exceptions like, who in the world at 20 and 25s can become, some of the world's largest entrepreneurs as well. That's fine, but what worked for them may not work for us.
Thank you so much. It's been a fascinating and a wonderful conversation. And thank you for taking the time.
Thank you. Thank you so much.
Thank you so
much. Appreciate it.
Thank you.
Thank you.
Out of time on tonight's conversation. If you have any feedback for us, do let us know. Our details on your screens as we speak. Thanks for watching. Have a good night.